Hello friends, welcome to Dezinlife. Friends, every industry goes through some corrections periodically. Now, whether industry like real estate, whether industry like share market, whether it's a gold market, and so on. Whatever industry you see, over a period of time or some period, every industry go through some correction. Domestic pharma industry also go through periodical corrections. Here usually corrections are very short, normally twice in a year. One correction we take every year in the month of March in the name of the closing. Another correction we take every year somewhere around October, November in the name of Deepavali or the Durga Puja. But corrections are there every year. Some year there are the big corrections. Like in 2016, it was a correction in the name of demonetization. In 2017, it was a correction in the name of GST and so on. Even if you look at, say, little more than a decade back, I believe something around 2005 or 2006, there was a correction because our government has, brought a new narcotics rules. So these corrections keep on happening. What happened during these corrections in the pharma industry? One is there is an inventory reduction in these corrections every time. Secondly, weak or unproductive people, their job change or removal, but there is a change at the people level always. And third major things happen is some rethinking goes on the strategies or overall on the business model. Now this time when we look at this corona crisis, with the passage of time different observations coming up, but what it looks like now, this corona pandemic is emerging as one mega correction in the pharma industry. This mega correction may last for maybe 6 months, it looks like, or maybe 9 months or 10 months or maybe a year or so. Depends, I believe something between 6 months to 1 year. Although the peak of this issue has gone as far as pharma industry impact is there, now onward I believe month after month impact will be less. But going back to the situation where we were in the February 2020, it may take time. So what is the different 10 correction things it leads to be now, or what looks to be now? There are 10 corrections happen, or in this mega correction 10 things will happen. One is that inventory will definitely reduce, and it's already reduced significantly. A second correction seems to be what doctor prescribe. So there are many product or many co-prescriptions which were there, which were not so much required, is still going on. So overall co-prescription will reduce. Number 3, there will be removal of the unproductive or the less productive people and the weak leadership, where the leadership or weak are not delivering result. There is going to be change there, and it is happening already. Number 4, it will leads to putting right meaning of the expansion. See, when we say expansion does not mean people expansion, but can be customer expansion, can be prescription support expansion, can be product expansion, can be therapy expansion, but expansion does not mean only people expansion. So right meaning of the word expansion. A fifth correction seems to be now reduction in the fixed cost. Now fixed cost usually one is office space. Office can be small office, comparatively more smarter office, and the distribution cost, which used to be going in the different company to company somewhere between 3 to 5%, it can further come down. And the sixth correction is the salary correction, more so at senior level, though salary has to bring down and it's coming down. And in some company where tops used to very heavy, too many people at top, so that top reduction or the scrapping position. Already there are some companies are there who are scrapping these positions, and the tops are becoming more and more light. And the seventh correction is, friend, which seems to be now, that is cushioning on age-old expense, which are basically more of customer to custom tradition. Something like monthly or quarterly meeting, it has to happen, whether agenda or non-agenda. Span of control of the manager, maybe 2 or 3 or 4, it has to go to maybe somewhere between 6 to 8. Then twice in a month, each field manager has to go for every territory. This can come down to once in a month. Then too much overall traveling by the staff, and the too many conference and too many conference participation. These are becoming some custom tradition kind of expense where industry were doing, so there will be cut in that. The eighth correction seems to be discussion goes back to per capita productivity, which was there in the beginning of industry. Somewhere we lost the track by adding too many people, and which was the missing now. So again, we will be talking more on the per capita productivity. The number of people can be less and they can be more productive. And ninth correction, which seems to be now, that is exposing or correction of weak business model, where business models are weak and it is not producing, or it is not something going to futuristic. There will be question mark or correction or the kind of closure. And 10th correction, which seems to be now, that is a break on the Me Too approach or the Me Too product, which is too much was happening, break free kind of thing. So there will be break on the Me Too product, on the Me Too approach, and the break on too many small companies. So that is another correction has to be there, and companies has to start working on more on differentiation or the customization. But as he says, by the end of every crisis, the good things or good picture always emerge out. So I hope after this pandemic, or you can say mega corona correction of the pharma industry, whether it lasts for 6 months or 9 months or 1 year, I hope good things, good picture will emerge out. And this 10 point will give you food for thought to think about, and whatever correction you want to do, because corrections are there, will be there, and it's a correction time. So thank you very much for watching us today.